An estimated 1 in 6 Americans are medically uninsured, and residents of the northern Black Hills are not immune to this hardship. But now, there is a place that those in need can turn. The Good Shepherd Clinic in Spearfish provides free medical services to the uninsured Monday evenings, serving more than 300 patients in 2009. Located at 1020 State Street, the clinic is set up at Our Savior's Lutheran Church. With a community of volunteers from all walks of life, nearly 160 volunteers in all are committed to this cause.
It's a real community event. It's a community ministry, a community outreach. A lot of different churches are represented each Monday here in volunteers, whether it's a medical person or a non-medical volunteer.
This Christian healthcare program is a giving ministry. There are no paid positions. Everyone involved, both medical and non-medical, are volunteering their time and services for this common ministry.
And I think the volunteers, I get as much out of it as the guests or the patients do.
Income-eligible residents of the northern Black Hills are screened with financial guidelines like those of Spearfish Regional Hospital. When patients do not have health insurance and cannot qualify for Medicare, Medicaid, Veterans Benefits, Native American assistance, or private insurance, Good Shepherd Clinic can help.
So when somebody comes in, we just ask them if they have any insurance. It's a very non-threatening situation. They have to show their ID, and we try to provide services.
Currently, some 20 medical professionals offer their time and talents on a rotation basis Monday nights. Doctors, nurses, and pharmacists from throughout the hills serve on the team. Dr. Steve Osler served as the initial clinic medical director. Now, Forrest Brady has taken on that role.
We have significant disease up here that we take care of, and that is kind of rewarding to be able to see people who in the real world probably aren't going to see anybody because of their lack of resources, and there's a lot of people falling through the cracks.
For the first year of operation of the 501c3 not-for-profit corporation, the annual budget was anticipated to be approximately $60,000, with the majority of funds spent on medications. All contributions that are received are used to support the clinic.
We, again, are very bare bones. We try to be very, very frugal with the money that is given us, and that money is primarily for medications.
The number of patients visiting the clinic is rising. On average, some 20 patients per week were seen at the clinic during the first quarter of 2010.
The response from the patients has been phenomenal. They're so grateful, so appreciative. You know, we're so thankful you're here. We're so blessed that you're here.
An array of volunteers are needed to set up, take down, and clean up the facility over a span of about 5 hours each Monday evening. The site is truly a simple setup with limited resources. After the doors open, volunteers help patients with registration and eligibility requirements. Nurses determine the severity of each individual and perform a triage process to accommodate those with the most serious illnesses first. A table with snacks and drinks is set up for patients in waiting. And when children accompany a parent, they too can enjoy a snack and play with a selection of toys made available to them. A resource center offers contact information for persons needing other living assistance, be it financial, counseling, housing, or crisis intervention.
Sometimes the patients have basically a need that the doctor has recognized, a support group that might be of interest for them, or just some other avenues to connect them with, that then they'll come over and we'll sit down and go through our directory.
Just get to know them a little bit so they feel that they have an advocate for them in the clinic.
And vice versa, nearly 50 social service agencies are now instrumental in clinic referrals. 2 physicians are on site to take patients. Like other volunteers, they are on a rotation schedule once every couple months to avoid burnout.
We have lots of nurses and we have enough doctors, but we're always wanting to get more doctors.
Spearfish Regional Hospital has partnered with GSC to provide access to lab tests and x-rays through their financial assistance program.
It was very important for us to be sure that we had a strong cooperative working relationship with the hospital, and Spearfish Regional Hospital has just been absolutely extraordinary to work with.
When the patients have scheduled lab draws or x-rays to be scheduled at the hospital, we coordinate that with the facility and with the patients to make sure that they know when and where they need to show up. If they need financial assistance, which they all do, we help them with the process of filing for their financial assistance through the hospital.
And Walmart and Safeway pharmacies will fill prescriptions for clients of the Good Shepherd Clinic at a reduced rate. How can you help? The Good Shepherd Clinic welcomes the talents of additional volunteers. The need is real, and the resources are limited. Financial donations are encouraged, and the power of prayer is never to be underestimated. The mission of the Good Shepherd Clinic: providing quality medical care for people without health insurance and to take the light of Christ into the community.